Today what we're going to do is we're going to do a physical exam. When you're doing a physical assessment, it's going to vary, the questions are going to vary depending upon what's going on with your patient. So today I'm just going to talk to you just a little bit about the physical exam part of it, what we're actually doing with the patient. So the first thing that I'm going to do is I'm going to have her take her glasses off so that I can look at her eyes, because I'm going to start with her eyes. And just like a bed bath, I start with the eyes. The assessment, the exam, I'm going to start with the eyes. So the first thing that I'm going to do is I want to look and see, do her eyes look together? Is she looking around? Is she looking together? Are the muscles moving her eyes together? So what I'm going to do is I'm going to have her look at my pin light, and I'm going to have her do the EOMs, or extraocular movement. So I'm going to have her go through the 6 cardinal fields. So I'm going to have her look up to one side. She has to hold her head still and just follow my pin light. And then I go across. Okay, that's all there is to EOMs. And her eyes, what we're looking for are eyes moving together. That's all we're really looking for. If they don't move together, it could be a muscle problem or it could be a neuro problem, a nerve problem. But they move together, so that's a good thing. So now what I'm going to do is I'm going to shine a light in her eye, and I'm going to look at the pupil and I'm going to see if it reacts to light. And when the pupil sees light that's really bright, what will happen is it's going to constrict. So that's what I'm looking for. So she needs to look off, way off in the corner, look at this doorknob over there. And so what I'm going to do is I'm going to shine this light in her eye, and I'm going to look and see if that pupil constricts. Then I'm going to shine a light in this eye again. I'm going to look and see if this pupil constricts, because it should. It's called consensual constriction. And the reason it does is because this eye tells the brain there's a light coming. And so then this eye will react to the light also. So now I'm going to do the same on the other side. I'm going to look and see if that pupil constricts, and then I'm going to look and see if the other pupil constricts. I'm probably not going to get pupil constriction in here because the lights are kind of bright and shining in her face. Normally, if I'm with a patient, I may have to turn the lights off. I may need to even shade their eyes in order for me to see pupil constriction. So then the next thing that I'm going to do is I'm going to do accommodation. And so with accommodation, what I'm going to do is I'm going to have her look at my pin light again and not move her head. And I'm going to bring this in, and I'm going to see, do the muscles move in? Do they converge? Do they make her eyes converge? And that's a good thing. That's what we want to happen. I don't have to bring it all the way to her nose and make her eyes completely cross. I just want to see, are the muscles moving in the right way? The other part of accommodation is where I have her look at something way far away, and I look at her pupils, and then I have her look at my pin light. And the pupils should do what whenever you look at something really close? Does anybody know? Pam, do you know? Yes, you do. Well, we'll think about that. Okay, so I've done her eyes. Now what I need to do is I need to look at her ears. So I'm going to look at her ears and see how her ears look. Does she have any wax? Does she have any lumps or creases or problems with her ears? And then I want to look at the other ear. Same kind of thing. Does she have a lot of wax? Does she have any tenderness or discomfort in her ears or anything like that? How about nose? Are you breathing okay? Any problems? Okay. Doing good. Okay. And then I want to look at her mouth. And so I want her to open her mouth. Good. And I want to look at their teeth and see how her teeth look. Look at her gums. Look at the buccal mucosa or inside the cheek and see how everything looks. Then I want her to stick out her tongue and go, ah. Okay. And what I want to do is I want to look and see if the uvula raises. And does it raise together, or does it raise in a straight line? If it's crooked to one side or the other, that's a problem. Okay. So then the next thing that I'm going to do is I'm going to look at her neck. And I want to see, how does her neck look? Is it in the center? Does she have any, bulges on one side or the other side? Do you have a sore throat or any problems with coughing or anything like that? No. the other thing that I want to do is I'm going to look and see if she has something called jugular venous distension. And so I'm just going to try it with her up a little bit. So I'm going to turn this light, and we'll talk about this more in the clinical setting or in the classroom setting, and I will show you more of that. But I'm just looking to see, does she have any jugular venous distension? She should not have. If she's sitting up about 30 degrees, she should not have any. If she's lying flat, I might see a little tiny bit of, see that jugular vein just a little bit, and that would be okay. It's if she's sitting up 30 degrees, does she have any jugular venous distension? So we're going to say that she doesn't. We're going to talk about jugular venous distension in the classroom a little more so that you can have a little bit better idea of what I'm talking about, because we can't get a great picture here. I'll show you a picture of somebody that does have jugular venous distension. So then the next thing that I'm going to do is I'm going to move on down to her heart, and I want to listen to her heart and see what her heart sounds like. And all that we ask for is that you listen and hear, is there any abnormality? So it's supposed to sound lub-dub. If there's something different than that, you need to let us know. But that's all I'm listening for. Does it sound normal? So I'm going to listen up here. And I'm going to listen on this side. And then because we're going to be doing physical assessment on each other and we have clothes on, we are going to listen through clothes. But normally on a real patient you would listen against their skin, because clothes can change the sound. It can give you a different sound. So I'm going to listen to her heart down here. Okay, so she sounds good. Not having any chest pains, no shortness of breath, no edema.
Little in the morning.
A little in the morning, okay. So I've listened to her heart, so now I want to listen to her lungs and see what her lungs sound like. So I'm going to listen to two places in the front. Okay. So just take a deep breath, mouth open. Sounds great. This other side. Okay, sounds really good. Now I'm going to listen in the back, and I think it's really, really important. It can't be overemphasized that the lungs, you need to listen in the back, because most of your lungs are in the back. And so you need to really listen in the back. So now what I'm going to do is I'm going to listen to her lungs in the back. I'm going to have her take a deep breath, mouth open. Okay, again. Again. One more time. Up, again. Okay. And when I'm listening to the lungs, I'm going to listen side to side, and I'm going to compare one side to the other side. And we'll show you a little more about that here in a little bit. Now I want to listen to her abdomen, check her abdomen. So I'm going to put her head down. So now what I'm going to do is the first thing I want to do before I touch her abdomen is I want to look and see what is the shape of her abdomen. And you have to remember that your patient's not going to have clothes on. We are going to have clothes because we're not really patients. So when we do our assessment on each other, we are going to have clothes on. So I want to look at the shape of her abdomen, and then I'm going to look and see if I see any abnormal patterns, movements, anything like that. Does she have any scars? How does the belly button look, the umbilicus? How does everything look? So after I've looked, the next thing that I want to do is I want to listen. So I'm going to listen to your abdomen. I'm going to move your hands. I'll listen and see what you sound like. I'll listen in all four quadrants. And I'm listening for bowel sounds. Great bowel sounds. Okay. Then the next thing that I want to do is I want to palpate. See, does she have any tenderness or any pain or discomfort? No. Now is a good time to ask them if they have any nausea or vomiting, if they've had any trouble urinating, or if they have any trouble with constipation or diarrhea or anything like that. Okay, so that is the abdomen. So cover her up. Then what I'm going to do is I'm going to check her upper extremities and lower extremities. So I want to see, does she have a pulse? Lo and behold, she has a pulse.
That means there's a heart.
There is a heart. I'm going to do capillary refill. And what if I can't do it because they have fingernail polish on? So I'm going to turn her hand over and I'm going to do capillary refill on the other side. Same thing on this side. I'm going to turn her hand over and see what is her capillary refill. Okay. So then the next thing that I'm going to do is I'm going to have her grab a hold of my hands and squeeze really, really tight, as tight as you can, and then pull against me and push against me. Okay, very good. So she has nice strong grips and she has good upper body movement. Okay, then the next thing that I'm going to do is I'm going to look at her lower extremities.
Mess up that pretty bed.
I mess up that bed. And whenever I do the lower extremities, I do come to the foot of the bed. And what I want to do is I want to look and see what does her feet look like. What is the temperature, the color of her feet? Does she have capillary refill? How good is it? She has red fingernail or red toenail polish on, so I can't do the toenails. I have to do other places. Then I want to see if she's got any pulses. And these are pedal pulses and tibial pulses, and her pulses are great. And then I want to have her push against me and then pull against me. Okay. I am going to show you a Hohmann sign just because I think you might see it on boards. I kind of doubt it, but you might, just in case it's still on there. And that's where I'm going to have her bend her knee just a little bit, and then I'm going to have her push her foot up towards her nose and see if she has any pain or tenderness in the calf of her leg. And do you have any pain or tenderness? Nope. Okay. No. And then I want to do the same on the other side. Have her bend her knee. No pain or tenderness. The big thing, and you can put your feet back down, the main thing that I want to look at, if I'm looking for somebody that has a blood clot in their leg, is I'm going to look for, do they have any edema? Do they have any warmth? Does it feel warm in the calves of their legs? Is one side bigger than the other side? Okay. That's it.